Thank you for tuning in to another week of Help Nobody Told Me. I'm Jasmine Shapiro. I'm with Berkshire Hathaway Home Services here in the Chicagoland area. Here with my co-host, Jordan Kagan, the man of silver.
Glad to be back for another great episode today.
And we are really excited because we have a returning guest. Today we're welcoming back Michael.Mann.
Thank you.
And you are a licensed insurance advisor with Health Markets and a trusted guide for our listeners who want to figure out Medicare and all the changes coming up, right?
Correct.
So yes, it's that time of year where everyone starts to talk about Medicare and changes. You work across 18 states. Helping folks compare Medicare Advantage, Medigap, and Part D, and even Marketplace, if I'm correct, for those under 65 like me. So, there's a lot of different programs and budgets, and one policy doesn't fit for everybody.
So you're correct, because sometimes a spouse will go on Medicare, and then you have to worry about, what am I going to go on? So that's when the Marketplace, so we work together, and it makes it a lot simpler.
Yeah, so I'm looking forward to hearing about some of the big changes from 2025 to 2026. Some Part D cap and some of these other things being under 65 I don't know about. But it's something I learned last year. At what age should someone, for those that maybe didn't listen to the podcast last year, at what age do people really need to start thinking ahead for what am I going to do with Medicare because I'm turning 65, and then what is the penalty if someone doesn't sign up by 65?
So, first of all, you don't have to be 65 to have Medicare. If you have a disability, I have 12-year-old clients. So you could be on disability and still have Medicare. You have to be on it for 2 years disability, then you qualify for Medicare. But when you turn 65, then you would talk to your agent, me, whoever, 3 months prior, because that's when you can sign up, 3 months prior to your 65th birthday, or 3 months afterwards. But you always want to sign up before because you want to start on your birthday month. And you would go either to the Social Security office, or you would go online, Medicare.gov, and that way you would be able to sign up. And gives you time because it's going to fly so fast. And then that gives you time if you have the spouse needs whatever product they need. Also, if you're working, then you want to work till 67 or 68 years old. You don't have to sign up for Medicare right away. You can wait, but 3 months prior to when you want to retire, then you want to sign up for your Medicare. A and B. A is for hospital, B is for doctors. And once you sign up for that and get that red, white, and blue card, that's when people can help sign you up for an actual plan, if it's a Medigap plan or Medicare supplement.
Okay.
So I always hear people saying when they're turning 65, it's your Medicare birthday.
Yes.
Yeah, right?
And then some people in my family, one person was very happy to be on Medicare because it's less expensive insurance.
Right.
The other one says, oh God, I'm 65.
Right,
so
exactly.
Everybody has their same
right.
thought.
Right. So then there's so many different parts in it, right? Besides the A and B and the prescription and all this. But what's really changing? Like, I know that you don't know everything yet.
Right.
But can you highlight any of the big changes from 25
One
to 26?
of the biggest changes for people in Illinois is we now have a dual plan. Dual means dual special needs plan, DSNP. So if you're on Medicaid, you now have the opportunity to have these DSNP plans. Most of the other states I deal with, they've had it for years and years. But the state of Illinois finally has it.
So it's only for Medicaid?
If you have Medicaid and Medicare, dual plan.
Got it.
And a dual plan is great because it allows you to, first of all, pay very little for your prescription drugs or nothing. Also, based on if you have some chronic conditions, you would be able to get maybe a certain dollar amount. It could be $50, $150. I mean, there's different dollar amounts based on the plans. But now you'll get money every month for food. You'll also get more money for dental needs, vision, and hearing if you do a Medicare Advantage plan.
Wow.
So that's the hugest thing, because there are so many people in Illinois are on Medicaid. And that's one thing I want to stress also. we've been hearing the news about Medicaid's going away, Medicaid's going away. Medicare is not going away. Medicaid, based on some criteria the government has, of course, you might lose your Medicaid, but Medicaid is not Medicare, and I've got a lot of people always call me up very concerned they're going to lose their Medicare. You're not going to lose it.
So what is the difference?
Medicaid is more of a financial issue. So if you make under a certain dollar amount a year from your gross income, you qualify for Medicaid.
Okay.
And Medicaid has different levels, and that can be any age.
Okay. So Medicare is not going away,
No.
right?
It's
Okay.
here to stay.
Excellent.
All right.
So AEP is an acronym. What's it stand for?
Annual enrollment period.
Okay.
So that's from October 15th through December 7th. That's when anybody can change their Medicare plan they
And
have.
is that in all of the 18 states that you're licensed in?
Yep,
So
yep.
is it all over the U.S.?
All over the whole
I was
U.S.
just going to ask you the places you're licensed in. You obviously know.
I go from New York to California to Florida, Louisiana, Texas, all
Okay.
the states around us here.
So
What-
until January 1st, sorry.
Until till December 15th.
December 15th,
Your plan will
October to December, and then the plan goes in.
In effect, January
In effect,
1st.
okay.
Now there is an OEP, open enrollment period, which is January 1st through March 31st. And that's when people can change their plan if they weren't happy with what they ended up getting. They end up finding their doctors are not in network or the prescriptions cost more. Then you can go to a different plan, one-time only change. That's open enrollment. But everybody really focuses on the AEP, and you're going to be
Annual.
bombarded with TV commercials, bombarded with
phone
phone calls,
calls.
and mail,
And text.
And text.
So, to reiterate, please, what are the dates for the automatic enrollment period? From
Annual
when,
enrollment.
or annual enrollment period, from what to what?
October 15th through December 7th.
Thank you.
That's annual enrollment.
That's when
period.
you enroll, and then it goes into effect in January.
Right.
And then there's also a one-time open enrollment. that
If you want to change,
If you
you
want to
don't
make
have
a
to.
change, but it's only one time. Okay. Now that we got all those acronyms sorted out. And then what is the Part D redesign?
The D, drugs.
Okay.
So that's usually people who have a Medicare supplement plan, also called Medigap. They would then get a prescription drug plan.
Does everybody get that?
When you have a Medicare Advantage plan, so you get the hospital, B is doctors, D is drugs. Those combined make a Medicare Advantage plan, a Part C.
Got it.
But if you want a supplement plan, and the supplement plan is when you pay monthly premium. For example, Part G is $265 a month.
Yeah.
You pay that you pay whatever the dollar amount is based on your age, but you pay a $265 deductible. Then the rest of the year you're done. You leave your wallet in your pocket. You don't pay for your doctor bills, physical therapy, anything. It's all included.
Is that the most common plan?
The most common Medicare Advantage plans, because those are $0 premiums, but they have an out-of-pocket. So that's why Medicare Advantage plan, most people, or a lot of people in America do it, 60%. It keeps on ranging more Medicare Advantage, and the supplements are dropping because they're getting very expensive. But people can always do supplements if they don't want to have to worry about paying every time you go to the doctor, every time you get blood work, x-rays, but you stop it in out-of-pocket.
Okay, so the D is for drugs, and how is it redesigned?
Well, the design, it used to be last year, there was something called a donut hole.
Oh, right.
And that's when you went to a certain dollar amount, and then you pay a higher percent, and then at $8,000, you're totally done out of pocket. This year, 2025, we're at $2,000. You're totally done. So if you have all these expensive drugs, pretty much the stuff you see on TV are those tier 4 and 5 drugs, then they'll reach that $2,000. But this year for 2026, it's going to be $2,100. And the new program they just started is like a level billing. So let's think about like when you do have your furnace and gas bills, you can always pay the same amount all year round.
All right.
They're now initiating that for prescription drugs as well.
Okay.
So now you can pay whatever your amount is, but level it off every month so it's the same instead of having a spike of $1,800 or $800 the first month or two, then you're down to $200. They can go level for people on their financial situation.
Yeah, so that's good for budgeting.
Yes.
Yeah.
So with Part D, are there any gotchas coming up in the new year, or gotchas in general that people should know about?
I mean, the big thing is you always want to get a prescription drug plan if you have a supplement. You never want to go without that Part D. It comes with your Medicare Advantage, but your Part D, if you don't get it, then you get penalties. It's only 40 cents a month. No deal, no big deal. But after 12 months, you're at $5, let's just say. After 10 years, you're at $50 every single month penalty, plus whatever the prescription drug plan is. So you want to always make sure you are getting a prescription drug plan, whatever it is, even if you're not taking any prescriptions at this point, 5-10 years down the road, you don't know that. So there is, the gotcha is you make sure you get the D if you got a Medicare supplement plan.
And how about switching mid-year or leaving a plan? Is that possible?
That is possible. Supplement plans you can move, but when you want to sign up for a Medicare supplement plan, when you're 65 and you first get the initial period, there's no underwriting. You could be on hospice, have cancer, they have to take you. But after that period of time, 6 months, a year, you want to try to sign up for it, you won't get it.
That's a big gotcha.
Right, that's a big gotcha. Also for Medicare Advantage plans, you are allowed to call special SEP, special election period, if you want another acronym. So that could be like March through November, but that would be if you moved, because anytime you move your zip code and county, you need to change your Medicare plan. Always contact your agent who you have. And also if you got a chronic condition, diabetes or heart, you can change your plan. So there's certain reasons you can change, but otherwise you have to stick to that plan the whole entire year.
Okay.
So for high-cost drugs, what changes in 2026 when negotiate prices kick in for the first set of Part D?
There's some new drugs, which I don't have right now handy, that the previous administration got down in price a lot. So you're going to notice actually a lot of diabetic drugs, they're really, really expensive. They're going to be a lot less this year coming up. It used to be 5 this year, 2025. We have about 10 more coming up for 2026.
Okay.
So they're going to be less expensive than the drugs. But in general, the drug prices, the other tiers are going to be a little bit higher because remember, they went from $8,000 to $2,000. They need to make their money still, the carriers. So the drugs, the normal drugs that were really less expensive are going to be up a little bit. Not a lot, but they're still going up.
So those diabetes drugs that are going to be lower in price, is that only for Medicare or across the board for people under 65?
Just Medicare right now. So it's like insulin's going to be $35 and capped. So anybody has...
Instead of like $150
now it's $35. And a lot of these new plans are going to have those things you put on your arm, and those will be at no price.
Continuous glucose monitor, which I think every diabetic or pre-diabetic should have.
Exactly. And those, a lot of them are going to be at no cost this year for 2026.
So for everybody?
Right.
Oh.
Everyone on Medicare.
Oh, just on Medicare.
On Medicare, most of the Medicare plans, I'm going to say all, but most of them.
Okay.
They're really, the key for Medicare is they want to keep you healthy. A lot of these new plans, they're incentivized. They want you to go to the doctor. They'll give you some money to go to the doctor, little gift cards. They want you to get all those diagnostic tests. The healthier you stay and stay out of that hospital, the better it is for the system. It'll be the least expensive. Catch it before something comes. If you wait too late, it's going to be very expensive.
But then they want you to take all these drugs.
Exactly.
$1 for prevention versus $10 to treat.
Exactly.
So they're realizing $1 prevention, they're saving a lot.
Right.
All right, so what is the typical MOOP? Is that what it's called? The out-of-pocket max?
So there's HMO plans. First of all, for Medicare supplement plans, Medigap, we talked about it, no MOOP, no out-of-pocket, because you're paying as you go.
Okay.
So what I usually do is I look at whatever let's say it's $200 a month for your supplement plan, times 12 is $2,400. That's the maximum someone's going to be out of pocket. But really, and they have to pay that $2,400. They're done. Versus if you have Medicare Advantage, $0, your MOOP, it could be $3,000. Every state's different. So it could be like $3,000 for an HMO plan and $5,000 for a PPO plan. So that's when I always tell people they like their Medicare supplement plans, but if they're going to end up paying more because as you get $75.80, it might be $400 a month for $4,800, and you got these plans with the MOOP or out of pocket that's only $3,500. You're going to save $500 because you're not necessarily going to go to the doctor and need it.
I don't know about you, Jordan, but oh my gosh, all these acronyms. I mean, like, we need someone like you if we're ready to sign up. I think everybody needs an insurance specialist that could kind of navigate all this.
You should definitely have somebody. I mean, whoever it is, you always need someone to navigate this for you.
Yeah.
I feel like we need Sesame Street all over again. Remember there used to be Count, and he would do all the numbers? Well, here I think we need all the letters.
Oh my goodness, I know.
Part D, A, B, C, D, M, O, O, P.
And don't forget, supplement plans have different letters. There's G's and N's. I mean, the key is your agent you should find should be at no cost. And certification, I mean, literally, we do an AHIP certification every year. We do, each carrier has training. So there's like 2 months of training every single year to stay up to date.
So for those 2 months, the only thing you can really want to say to yourself is OMG?
Yeah. That's good.
Thank you, I try.
So, all right, so we have, let's see.
So we talk a lot about supplemental benefits.
Right.
I know we talked about earlier, you know it's Medicare time when all of these ads are on TV and radio. So what's new in some of these plans so people can be aware of what's coming for the new year?
So usually we talk about Medicare supplement plans. That takes the place. So if you have original Medicare, red, white, and blue card, 80-20. 80% the government pays, 20% you would pay for the bills. The supplemented gap plan, whoever it might be, that 20% is what covers it. So all they're doing is covering the other parts of Medicare for the hospital and the doctors. A Medicare Advantage has the supplements you're talking about. Dental, vision, hearing. They have over-the-counter benefits. What is over-the-counter? I always tell people, look at your pharmacist, okay? You put your back to the pharmacist and you look out. If it's the Tylenol, Leave, ibuprofen, dental products, Depends, all that stuff, these programs, they give you quarterly, they give you money to go towards buying these products. And that one's been going up higher and higher. They are watching themselves, all these Medicare Advantage plans, as far as how much dental. They usually they get a certain pot of money. So they can give more on dental and less on vision, or they get more on hearing. So there's a certain dollar amount that they each have that CMS regulates.
So if you're a snowbird or a traveler, are there things you need to be aware of?
So keep in mind there's HMO plans and PPO. HMO is when you have a doctor, primary doctor, and you get referrals. You have to get referrals. PPO means you can go to this doctor here, but he really doesn't know about Jordan, who's the plastic surgeon. No, not plastic surgeon. He's the orthopedic surgeon. And I'd rather so I don't want to go through you. I'll go right to the surgeon, and that's a PPO. I can go in and out of network. So the snowbirds prefer the PPO plans because then they can go anywhere. So if they're visiting their child in Florida and they got a cough, they want to go see another doctor, you use a PPO plan. If you have an HMO plan, you get in a car accident in California, no matter where you go, if you're in an accident, you have an HMO, a hospital has to take you. So don't ever worry that you're not covered, you are. It's just when you want to go to those other doctors.
But that's the same whether it's Medicare or not, right?
Right.
Okay.
And then in the supplement plan, you can go anywhere and don't worry about it because you're leaving your wallet in your pocket.
Right.
So let's go, I'm on vacation in California. God forbid I get in an accident. The ambulance is involved. They take me to the local hospital. But I have a broken arm that needs to be set. So now the hospital is sending me to an orthopedic surgeon. That's a doctor. I know you said any hospital has to treat you.
Right.
But now it's not just a hospital. Now it's a doctor, which is...
Well, usually if you're in the hospital, they're going to fix it while you're at the hospital. I don't think they would bring you to the practice and do it. If they wanted you to go see someone, if there was something wrong and go in a week or two, if it's still bothering you and talk to your doctor, then yes. You didn't need this special
I'm just
permission.
saying, I'm used to the hospital. You don't realize how many different bills you get.
Right.
Sometimes it's a hospital employee. Sometimes it's outside.
Well,
that's why I'm asking.
Right. No, if it's a doctor that's there that day who's the orthopedist, then you're still covered. I just mean if you have to go to his office.
Thank you for clarifying.
Yeah. Once you go to his office, then you're in a different realm.
And I think that's one thing why we have you back is
Right.
This is complicated.
Very.
So to one, try to clarify, and two, discuss what's new, you know.
So if someone wants help, like going to a hospital, or what should they bring? Like the medicine list, or?
I always take a picture of all my medicines. It's on my phone. So
Okay.
I always bring that with you because it's easier to remember.
That's a good idea.
And then your doctors, hopefully you have a list for them as well. When you're going to show something, you show that Medicare card and your supplement card. If you have a Medicare Advantage, I know we're getting confusing again, keep your Medicare card locked away because you don't need it ever. You have your Medicare Advantage card. That's what you show the doctors in the hospital.
Okay.
And it's not related to this, but one thing you said, what you have saved on your phone or emailed you, that's so important if you need it in an emergency. And I always say most people don't know what's in their wallet if there's an emergency. And having that backed up in the same place as your medical stuff is important. You know, most people don't have a backup of their credit card or their driver's license, or if their wallet disappears, they don't even know what was in there.
And I work with a lot of power of attorneys because I'm working with older people.
Sure.
So I want to make sure that their kids have those prescriptions. They should have it on their phone because they don't know what their parents are taking.
Right.
So that's what I was thinking. They don't know the doctors. So I think it's very
Very
important
smart.
for the kids or whoever the power of attorney is
Right.
to have a list of
We
items.
used to have a list typed up that, my mother had, and we took a picture of that.
Exactly.
Yeah.
It-
But then when it changes and they don't tell you, that's a problem.
yeah. I mean, there's hospital systems are supposed to exchange. Even work with the pharmacies. They're supposed to have everything there, but they don't always.
Yeah. Well, I think we got a lot of information today.
Oh, yeah.
And I'm so happy you were with us
Oh,
today.
had fun.
And again, we will link your contact information to our show notes. But yeah, there's a lot to unpack, and I think it can be very confusing. And it is really important to have somebody like you who's an expert in all of this, all of what goes on with Medicare, Medicaid, but also all the changes.
And I think, one thing I've learned personally too is, just because you're 75 years old and you've been on Medicare for 10 years, it's really, really important to review your policy annually to make sure you have the best for yourself. And when I hear people that have gone 5 or 10 years or never reviewed it,
Right.
they don't know where they stand.
And when the changes are, as you know what's going on in the industry, hospital systems and doctors. So you have to have your plans looked at every year. Because in the Chicagoland area alone, there's some hospital systems that are not taking certain plans now.
Oh,
And-
really?
Yes. So that's for 2026. You need to know, find out right away if your carrier takes that hospital or those doctors. Because that's the most important thing. Doctors in network, prescription drugs, other stuff is just frills.
Thank you.
Wow. Well, thank you so
again,
much.
Michael, for
Thank
being
you.
here.
Yeah.
It was fun.
And tune in next week for another episode of Help Nobody Told Me. Please follow and share this episode to anyone who you think might benefit from all this information.
And thank you again, Jasmine, for hosting with me and for all you tuning in.
Thank you.